Picture this. You're sitting in the dentist's chair, and instead of discussing dentures or implants after losing a tooth, your dentist tells you that in a few months, you could simply grow a brand new one. Sounds like science fiction, right? Well, Japanese researchers are turning this dream into reality, and what they've discovered could revolutionize dentistry as we know it. Welcome back to BioWell Hub, where we explore the cutting edge of medical science and breakthrough innovations that are reshaping our understanding of human health. Today, we're diving deep into one of the most exciting developments in regenerative medicine, a groundbreaking treatment from Japan that could allow humans to regrow their own teeth naturally. This isn't about implants or dentures anymore. We're talking about genuine biological tooth regeneration, and the science behind it is absolutely fascinating. For decades, losing a permanent tooth meant accepting that it was gone forever. Unlike sharks, which can regenerate thousands of teeth throughout their lifetime, or even certain reptiles that continuously replace their teeth, humans get just two sets, our baby teeth and our permanent teeth. Once those permanent teeth are gone, whether through decay, injury, or extraction, we've had to rely on artificial replacements. But Japanese scientists have been asking a provocative question. What if we don't have to accept this limitation? What if the ability to grow new teeth is simply dormant within us, waiting to be reactivated? The groundbreaking research comes from a team at Kyoto University and the Research Institute for Microbial Diseases, led by Dr. Katsu Takahashi. After years of meticulous study, they've identified a specific protein in the human body that essentially acts as a brake on tooth development. This protein, known as USAG1, plays a crucial role in regulating tooth formation during our early development. Think of it as a biological stop sign that tells our body when we've grown enough teeth. The researchers discovered that by temporarily blocking this protein, they could trigger the growth of new teeth in test subjects. Now you might be wondering how exactly this works at a molecular level. Our bodies actually produce far more tooth buds during development than we ever use. In fact, scientists have found evidence that humans have the genetic capability to grow a third set of teeth. But this ability is suppressed by various biological mechanisms, including USAG1. This protein interacts with other growth factors in our mouth, particularly one called BMP, or bone morphogenetic protein, which is essential for tooth development. When USAG1 binds to BMP, it prevents the signal that would normally trigger new tooth growth. The Japanese therapy works by introducing an antibody that blocks USAG1, essentially removing the brake and allowing those dormant tooth buds to develop into full teeth. The initial trials have been remarkably promising. In laboratory studies using ferrets and mice, animals that share similar dental patterns with humans, researchers successfully induced the growth of new teeth by administering this antibody treatment. The new teeth that grew weren't just random calcium deposits or malformed structures. They were fully functional teeth with proper enamel, dentin, and root structures. Even more impressively, these regenerated teeth integrated naturally with the surrounding bone and tissue, just like natural teeth would. But perhaps the most exciting news is that human clinical trials are now underway. The first phase of human testing began in Japan, focusing on adults who are congenitally missing teeth, a condition called tooth agenesis that affects roughly 1% of the population. These individuals are born without certain permanent teeth due to genetic factors, making them ideal candidates for this pioneering treatment. The study aims to determine not only the safety of the therapy but also its effectiveness in triggering tooth growth in real human patients. The treatment protocol itself is surprisingly straightforward, at least in concept. The implications of this technology extend far beyond people with congenital tooth absence. If the trials prove successful, this treatment could eventually be available to anyone who has lost teeth due to cavities, gum disease, accidents, or necessary extractions. Imagine elderly individuals being able to regrow their natural teeth instead of relying on dentures. Consider the impact on quality of life, nutrition, and self-confidence for millions of people worldwide who struggle with tooth loss. Of course, this revolutionary treatment doesn't come without questions and challenges. The current timeline suggests that if all goes well with clinical trials, the therapy could be available for practical medical use by the year 2030. That might seem far away, but in the world of medical innovation, bringing a completely novel treatment from the laboratory to widespread clinical use in just a few years is actually remarkably fast. The researchers must ensure that the treatment is not only effective but also safe, with no unintended consequences like excessive tooth growth or other developmental issues. Cost is another consideration that many are curious about. While specific pricing hasn't been determined yet, the initial treatments will likely be expensive, as is typical with cutting-edge medical therapies. However, history has shown us that as regenerative treatments become more established and production scales up, costs tend to decrease significantly. The long-term economic argument for tooth regeneration is actually quite compelling. When you consider the lifetime costs of implants, bridges, dentures, and repeated dental work, a one-time regenerative treatment could actually prove more affordable in the long run. The broader scientific community has responded to this research with cautious optimism. While the results so far are encouraging, dental researchers emphasize that regrowing teeth in humans is considerably more complex than in smaller mammals. Human teeth are larger, take longer to develop, and our jaws have limited space. There are questions about whether regenerated teeth will emerge in precisely the right position, whether they'll have proper bite alignment, and how the treatment might be tailored for different individuals with varying degrees of bone loss or gum disease. Despite these challenges, the Japanese research represents a paradigm shift in how we think about tooth loss. For the first time in human history, we're approaching dental care not just as maintenance and replacement, but as genuine regeneration. This aligns with broader trends in medicine toward regenerative therapies, from stem cell treatments to organ regeneration research. As we watch this remarkable science unfold over the coming years, one thing becomes clear: the future of dentistry looks dramatically different from its past. The drill and fill approach that has dominated for over a century may one day give way to injections that simply tell our bodies to fix themselves. It's a testament to human ingenuity and the relentless curiosity of researchers who refuse to accept that tooth loss has to be permanent. Here at BioWell Hub, we'll continue following this story as it develops, bringing you updates on the clinical trials and the eventual rollout of this incredible technology. If you found this deep dive into tooth regeneration fascinating, make sure to subscribe and hit that notification bell so you don't miss our future coverage of breakthrough medical innovations. Drop a comment below and let us know. Would you try this treatment if it becomes available? Until next time, stay curious, stay informed, and keep exploring the amazing possibilities of biological science with us. Claude is an eye and can make mistakes. Please double-check responses.